Hello, my name is Nicholas Cohen. I'm a primary care doctor with a practice in downtown San Francisco. I created Health Score. Health Score is a comprehensive program to optimize health and extend lifespan. Today we're in the section on psychological health. We're talking about depression and specifically recommendation number 5, treat depression. Let's take a closer look at the definition and prevalence of depression. We're talking about major depression, and major depression is defined as experiencing at least one major depressive episode. A major depressive episode is a period of at least 2 weeks where you experience depressed mood or decreased interest or pleasure in doing things, and some difficulty with one of the following symptoms: sleep, eating, energy, concentration, or self-worth. There's a validated and commonly used screening instrument to determine if 1, someone has depression, and 2, how severe that depression is. It's called the PHQ-9, or Personal Health Questionnaire, with 9 questions. And you ask yourself, how often have you been bothered by the following over the last 2 weeks? And response possibilities are not at all, several days, more than half the days, or nearly every day. Question number 1. How often have you been bothered by the following over the last 2 weeks? Little interest or pleasure in doing things. You determine what your response is, and you assign yourself that number of points shown in the cell. You do this for all 9 questions. 1, little interest or pleasure in doing things. 2, feeling down, depressed, or hopeless. 3, trouble falling or staying asleep or sleeping too much. 4, feeling tired or having little energy. 5, poor appetite or overeating. 6, feeling bad about yourself or that you're a failure or have let yourself or your family down. 7, trouble concentrating on things such as reading the newspaper or watching television. 8, moving or speaking so slowly that other people could have noticed, or so fidgety or restless that you have been moving a lot more than usual. 9, thoughts that you'd be better off dead, or thoughts of hurting yourself in some way. I would pause the video and determine your score. It should be somewhere between 0 and 27. You can then use that score. If your score is 0 to 4, you have minor symptoms of depression, but not actually a major depressive episode. If your score is 5 to 9, this is characterized as mild depression. 10 to 14 is moderate depression. 15 to 19 is moderate to severe depression. And 20 to 27 as severe depression. The prevalence of depression in the U.S., 8.1% of U.S. adults have a major depressive episode each year, and 1 in 5 adults, or 21%, have a major depressive episode in their lifetime. So depression is common. This is an easy way to diagnose if you have it and to know how severe your depression is.